Hi everyone, we're back, and the topic of discussion today is the endocrine system. We're not going to be able to cover everything, so I advise you to go to dearnurses.org, where you have tons of helpful information on the endocrine system. I'll try to wrap it up as quickly and efficiently as I can. We know that the endocrine system is really important, and there are different glands in the body known as part of the endocrine system, which are instrumental. They secrete hormones, very important for growth and reproduction. I'll just cover a few of the glands: the hypothalamus, the pituitary, the thyroid, the islets of Langerhans in the in the pancreas, the ovaries, the adrenals, which are situated on top of the kidneys and are known as the glands of fight, fright, and flight. They secrete, one of the important jobs they do is secrete epinephrine. Like when you find yourself in a frightening situation, an epinephrine goes to work. And that is the gland that makes you feel like you have to run away from danger. And so, like I said, dearnurses.org is packed with tons of helpful information. Next, we're going to talk about the thyroid gland. And the thyroid gland is described as the largest of the endocrine glands. It's butterfly-shaped, and it's in the front of the windpipe and the lower part of the neck. It secretes two very important hormones, T3 and T4. And it also is responsible for iodine, that iodine that's taken up in your diet, and helps to keep things going right with, let's take, for example, hypothyroidism, when there seems to be a lack of iodine, and which causes like weight gain and slow mentation, loss of memory, or you may have hypothyroidism, where you have increased heart rate, a lot of nervousness and anxiety. The hypothalamus, which is situated in the brain, has a direct effect on the pituitary gland, and vasopressin is secreted by the pituitary as well as oxytocin. And these are very, very special hormones. They have tremendous amount of work to do, which will be discussed at dearnurses.org. Let's go on to the uterus and the ovaries. And estrogen and progesterone are hormones which are very important, as we know, in pregnancy and reproduction. And these hormones are usually secreted. Well, actually, when people go through, women when they're pregnant go through lots of changes because of these hormones. Even it has been noted things like nasal stuffiness in pregnancy is because of this extra hormone, these progesterone and estrogen. If you take a look at some pregnant women, they look as if they're wearing a mask, which is called cloasm of pregnancy. This again is due to hormonal action. Another thing is we know that as women go into menopause or the change of life, lack of hormones like estrogen has its own impact on the body. Some people tend to gain weight very easily, and you can see that you're not as fertile anymore as when you were a younger person, and it becomes more difficult to get pregnant as the hormone levels start falling. So take a look at dearnurses.org, packed with helpful information. Also the clinical setting, dearnurses.net, chapter 10 of What Is It?, which is just a collection of helpful clinical information. I wanted to talk to you about insulin, and I guess I don't think of a nurse who's not familiar with insulin, as that is the one we know that we give insulin to patients who are lacking insulin. It is secreted by the islets of Langerhans in the pancreas, and it has very important work to do in controlling blood sugar. And of course, last but not least, I'm going to just quickly mention prolactin. And this is a hormone which is secreted by the anterior pituitary gland. There are other hormones also, but this one is very special, which is responsible for the production of breast milk. I hope you've learned something from this. There's just so much information on hormones, and I've tried my best to cover as much as I possibly can by going to dearnurses.org. Have a great day.